Learning more about the growing humanitarian crisis there and how it's impacting the region's most vulnerable. The UN reports that 50,000 women in Gaza right now are pregnant, and 5,500 of them are expected to deliver in the next month. Joining me now from Cairo, Laila Baker, Regional Director for Arab States for the UN's Agency for Sexual and Reproductive Health. Laila, just talk to us about the health crisis for women right now and children as we are seeing the conditions worsen there in Gaza.
Good evening. Thank you very much for the question. UNFPA is exceedingly concerned about the situation of the 2.2 civilian population million population inside Gaza at the moment. You quoted correctly that there are about 50,000 pregnant women and 5,500 who need to give birth. In the current circumstances, with the lack of fuel, water, hygiene, you can only imagine what it's like for a poor woman now, a Palestinian woman, trying to find some place safe that she can give birth to. From the reports that we've been receiving, even if you can make it to one of the standing, reasonably functioning health facilities, that you will likely find unhygienic circumstances, doctors who are overwhelmed with the casualties that are arriving. And in the event you need a cesarean section, some of them are being conducted only with the light from a mobile phone, for example. And in some cases, we have received reports that the C-sections are being done with lack of anesthesia. I can only imagine the trauma and the choice that a poor woman who's trying to deliver a baby to bring life into this world is facing under those circumstances. And this is why a ceasefire is critical for us to be able, as the UN, not only to bring in goods to Gaza, but to cater to the needs of the most vulnerable, amongst them the women and children who have been disproportionately impacted by the violence.
I mean, I want to follow up on that, Laila, just thinking about the amount of women we just talked about to give birth, giving birth, will give birth next month. If they can't get to a clinic, a hospital, a doctor of some sort, what usually happens? Is it the type of situation where they are in their home, hoping that they have somebody with them that can help them deliver that child? Is that what it's going to come down to, do you think?
It's already come down to even worse than that. Put yourself in the shoes of a woman who's fleeing the bombs that are, you yourself quoted the number of attacks that have been disproportionately rained down on Gaza, on the civilian population in the last weeks. There have been nearly 150 attacks on health facilities. So if you are a pregnant woman trying to flee from that situation, and even if you could find shelter where most of the places are makeshift, they're schools, they're houses, they're under bridges, wherever you can take refuge. In those areas, there has been no water, no fuel, no electricity, no food, no medication. Nothing. It's a complete siege, which under international humanitarian law is not only illegal, but outrageous. It's basically collective punishment for 2.2 million civilians. In order to cater to the pregnant women, which is the main concern right now for UNFPA, we're trying to get in through the humanitarian corridor what we call safe birth kits. It's a very simple kit. It contains the hygienic things that you would need: a pair of scissors, a bar of soap, and a clamp for the umbilical cord with a plastic sheet.
Does it come with instructions?
It does not come. There are basic instructions in there, but if you've ever had to deliver a baby under those circumstances, you can understand that it's precarious, and we are very fearful for the outcomes of those mothers. in the best of circumstances, she's going to find herself in a place where it's very difficult to breastfeed, to keep her baby safe, herself safe. So she fears for her own life and that of her child and her family. And in the worst of cases, there's no one to cater for her. What happens if she goes into labor and there are complications? What happens if there's hemorrhaging? You can only anticipate and imagine the worst for her and her families. That is an immediate and urgent need that UNFPA calls on everyone involved to exercise and observe international humanitarian law and allow for us to be able to provide that care.
And not only provide that kind of care, but let me just talk, you know, the Gaza Health Ministry, which we want to point is controlled by Hamas, is saying now that more than 9,000 Palestinians have been killed in this war, most of them women and children. What more is your agency doing or planning to do right now just to help and protect this most vulnerable population, not just women that are about to give birth or are giving birth, but just the kids and their mothers that don't have the means to understand even how to attempt to evacuate?
I don't even think that it's a matter of evacuation, if I could be so bold. This is a civilian population that lives in Gaza, that's always been there. The UN has had operations in there for 50 years, even under the siege for the last 17 years, without incident. We provide on the basis of the most vulnerable populations. We work with partners who are medical professionals, and even in similar circumstances, we've always been able to provide without incident. I don't see why this is this is of concern at this moment. And where pregnant women are concerned, we really need to address that ceasefire issue. Without a complete ceasefire, without the opening of the borders to be able to get goods in, whether that's food for the nutrition of the population, whether it's water because everyone needs water, that's the most basic of elements that human beings need. And to respect the engagement of international humanitarian law, what we can do is a drop in the ocean. If I can just quote one of the women who we spoke to, who said, every second was a race to death. I could feel with the bombs around me. Every kick of my baby, I feared for her life. But it also gave me hope that there was life in me and I needed to protect it. We need to do everything that we can to protect the sanctity of the life and civilian life in Gaza with everything that we have. And that does require a ceasefire, and it does require that we are able to deliver unhindered and in safety. Hospitals, medical professionals are not a target under any circumstance. And we urge everyone who is involved in this, and we call on them to respect those rules of engagement. Until we do, I fear that the outcome for many of those pregnant women is not a good one.
Well, just listening to those words from that pregnant mother, it's chilling. And thank you, Laila, so much for just putting everything into perspective for us and bringing light to these hardships. I'm glad we could have the conversation, and I'd love to follow up, Laila. Thank you very much.
Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.